Prognosis. If the patient's lung injury does not soon begin to heal, the lack of sufficient oxygen can injure other organs, such as the kidneys. There is always a risk that bacterial pneumonia will develop at some point. Without prompt treatment, as many as 90% of patients with ARDS can be expected to die. With modern treatment, however, about half of all the patients will survive. Those who do live usually recover completely with little or no long-term breathing difficulty. Lung scarring is a risk after a long period on a ventilator, but it may improve in the months after the patient is taken off ventilation. Whether a particular patient will recover depends to a great extent on whether the primary disease that caused ARDS to develop in the first place can be effectively treated. Prevention. The only way to prevent acute respiratory distress syndrome is to avoid those diseases and harmful conditions that damage the lungs. For instance, the danger of aspirating stomach contents into the lungs can be avoided by making sure a patient does not eat shortly before receiving general anesthesia. If a patient needs oxygen therapy, as low a level as possible should be given. Any form of lung infection or infection anywhere in the body that gets into the blood must be treated promptly to avoid the lung injury that causes ARDS.